Good morning, guys. Today we are talking about interesting case details with results, and that's the class 5 baldness transplant results. Usually, why we are talking more about on this is usually class 2, class 3, class 4 baldness having a smaller area baldness. Usually, we can get the density in a single session. When it comes to class 5, class 6, and class 7, you have a lot of more baldness. Actually, they must have lost most of the areas, and they need more hair too. Today, well, we are talking about class 5 baldness eye transplant and how we achieved best results. What are the challenging factors? What are the tricks we need to use to get best outcome? We are going to discuss today. Kindly watch the video until end to understand class 5 baldness hair transplant results. Well, when we are talking about classification of the baldness, most of the times we should not go by the classifications because baldness usually the hair transplantation results usually depends on size of the scalp. Basically, if the scalp size is bigger, it doesn't matter any class. So just to understand basic things, it is divided into class 1 to class 7. Otherwise, scalp size is the one, and availability of the donor is the one who's going to decide on your hair transplantation outcome and results. Well, today, such classification, class 5 baldness we are talking about. Usually, class 5 baldness has frontal hairline baldness, mid scalp, as well as the crown area also. Three areas, it's a challenging for any doctor to get best results with one session. Here, important point to be noted is, when provided if there is a best donor, alone best donor, best doctor doesn't get you a fantastic outcome. A beautiful plan which is going to be suitable to this patient is important, and best execution in the sense, imagine to implant and to get the best results in this kind of patient, we need a huge team. Why I'm telling this is because alone one surgeon sitting and doing this surgery does not happen the best, because we'll be harvesting, one person has to be helping you out, and lot many team, more than 6 to 10 assistants has to do the processing of the grafts. Processing of the grafts means they remove the fat, little skin, so that implantation goes very smooth later on. If surgeon harvests and himself goes for the separation and processing of the grafts, then you need more than 14-15 hours time for single transplant in this case, which is not going to be good for a patient, because we need to implant the grafts within 6.5 hours. That means once you harvest the graft out of the body, it has to come back and insert within 6 to 6.5 hours. Then only we get more than 90% growth rate. If it goes beyond 7 hours, 8 hours, 9 hours, each 1 hour you reduce 20% of the growth rate. That is really not acceptable. So that is the reason you need a huge trained best team. In the sense, when we are harvesting, immediately they need to take the grafts and process it. Processing means separation of the fat and not the separation of the grafts. Okay, separation of the fat and removal of the epithelial skin. Then only you get natural results, best growth. And that's the important point to be noted when you are doing your research in a transplantation results. No best transplant will happen with sitting with one or two surgeons and one assistant, because this is a kind of a time constrained surgery, and this is a unique surgery when compared to any other surgery. It takes a lot of time, but a time constraint is there. That's the reason we need to plan such a way that each and every minute is precious. When we are harvesting, the way we need to harvest, the way we are going to keep the grafts outside the body, we are going to preserve in a cold solution. Even though 6.5 hours is a critical time, golden hour for the eye transplantation results. For that, we need to have a huge team, big surgeons, lot many assistants to help you. Setting one or two persons does not get you a best outcome for you. A huge team means huge team, more than 30-40 members required for getting a beautiful surgery outcome. Cases like this, especially class 5 baldness. That's what we do in our routine practice. so that our grafts which are harvested are supposed to come back to the scalp back within 6 hours. At times it happen within 4.5 hours we can implant two. Actual time is harvestation time to implantation time. Of course, there are few preparations will be there before transplant that cannot be counted. Only after harvestation. Imagine first set of harvestation we have done a couple of grafts that has to be separated and has to be implanted in the first itself, so that we are going to save the time and achieve the best outcome. Well, come to this patient, it's a kind of challenging patient for anyone because it's a huge scalp and we need to implant front, mid scalp and crown area. So we need to plan his surgery in such a way that a graft has to be implanted within 6.5 hours, and as well as the other preparations also. If you can observe the results for this patient after 10 months, beautiful thick hairline and unbelievably density in the mid scalp and even in the crown also. 95% of the area has been covered, and of course there are few patients may need second session also. Luckily this man got fantastic outcome because of the best team we have with us, and even he had a best donor also. All this turns out to be a best outcome for him. So having a best team and kind of an expertise team and a lot many surgeons around with you, and can definitely bring your hair transplant results definitely better than any other clinics who is doing with one or two surgeons. That's the important point. Most of the patient would not notice it because they don't even get to know what is happening inside the operation theater. They only see only one executive, one doctor before consulting them, but they have to think about choosing a best doctor as well with best team. That's what. Conclusion for this kind of video and this kind of results is class 4, class 5, class 6 or class 7 baldness requires a lot many number of grafts, best surgeon, expert surgeon along with his best team. This is the conclusion of this kind of results. Otherwise, you hardly get a few grafts done in one session. Imagine 3,500 grafts is impossible to do by one doctor sitting around. Then you don't get any good results. So that's the whole story of this video. Conclusion is not only having a best surgeon, he has to have a best surgeon team around with him and even best team around with him who can facilitate easy surgery so that we can do the smooth surgery and you can get a fantastic outcome. Thanks for watching our videos. Kindly watch more videos on hair transplant to understand the basics and expertise views from the hair transplant surgeon's view or results also. Thanks so much.